I really want everyone to recognize that if we try to solve this problem for every single person, we will never move forward. That said, what has worked with Healthy Villages is that if you look at the meaning of Healthy Villages, it's heal the villages. And so we don't go into these communities and say, you're going to have to use our program and everybody else move to the side. In East Africa, we've partnered with Kajabi Hospital. We've partnered with the Lawala Community Health Center. We have partnered with the Robert F. Kennedy Center for Justice and Human Rights, which is an international community. We've partnered with Regis College and 5 nursing centers in Haiti. And so the way you scale this program is you go into the community and identify who is the Martin Luther King of that community, who is the Mother Teresa of that community. And through the ability to partner, I'm using a saying right now, which is collaborative IQ. The higher your IQ to collaborate with organizations, whether it be Doctors Without Borders, whether it be the Lawala Community Health Center, that's the way you scale this, because we have the devices. We don't have to do any more innovation. What we really have to do is integrate. Integrate what we have with what's in the community. And that's how you're going to scale this. The Robert F. Kennedy Center for Justice and Human Rights is an international organization. It is populated by some very famous board members, Desmond Tutu, President Bill Clinton. There's a host of international folks who make up this organization. And their prime mission is to address human rights across the world. Healthcare is a human rights issue. Article 25 of the Declaration of Human Rights states very clearly, healthcare for every single person across the world. And so I was fortunate to be appointed to the board. I'm the co-chair of the Robert F. Kennedy Board of Directors here in Europe. And it was a nice dovetail to have that organization, which is known all through the world, partner with us because it's validated Healthy Villages. And so together, we go into these communities from a social justice perspective and from a healthcare perspective. But remember, Healthy Villages is heal the villages. And so there are some cases where we're going into the community and we're providing education. We repurpose our medical textbooks to put them online so we can educate students who want to be a doctor. In other areas, we're helping a community develop a farm so that they can have revenue to supplement their needs as a family, but to also grow food where they can eat. And so with the Robert F. Kennedy Center, we work to understand what are the issues in that respective community. In Uganda, there is a bill right now before the legislature which makes homosexuality, makes it an offense that if in fact you are accused of that behavior, you can be put to death. And we have worked with the government there, and we were successful in getting the president recently to not sign the bill, to help them educate. So Healthy Villages can be a venue to educate, it can be a venue to provide healthcare, it could be a venue to provide revenue opportunities. And the RFK Center helps us to understand what those social issues are in respective communities. That's why it's been a very powerful partnership. In China, we have partnered with Project Hope. We have used their historical mission, which is to provide healthcare and services via the ships. Last summer, we used their tour through the Pacific to provide healthcare workers and our content, and they went into various communities that had never seen a doctor. In Uganda, we are partnering with Angels of Hope, where they built this wonderful healthcare facility after the Lord Coney went into Uchuma and basically devastated an entire community. They built this community health center, and what we did is we provided the services to open up a maternity clinic. In East Africa, we have partnered with the Kajabi Hospital. Dr. Mark Newton out of Vanderbilt spends 40 weeks there a year, and so we partnered with him. In Haiti, we've partnered with the Regis College and the various nursing schools. And so I don't think we can sit back and say we have these 6, 7 partnerships, therefore we're stopping. No. We are looking at each community and identifying what their needs are. And it's very interesting. We are brought to the partners. We don't have to search for the partners. We are brought to the partners. And so I would anticipate that there will be hundreds of partners, that this doesn't have to be limited to one partner. It'll be hundreds of partners.